Assalamu alaikum and a very warm welcome, viewers. My name is Dr. Mavish Martin, and I will be hosting today's episode of Mind and Body. Viewers, this is going to be the special edition of this show. We have a very, very special guest for you in our today's episode. In guest ke baare mein main kya kahun? I am literally just out of words when I was doing a research on him. It was just hard for me to pick, like what to pick and what not to pick. You know, so I have tried to write something little about him. Let's dive in. He's the Executive Vice Chair and Professor of Psychiatry at Baylor College of Medicine, Houston, Texas. And he's also the Chief of Psychiatry at Bintab Hospital Harris Health System. He has done numerous media presentations to both national and international radio, television, newspapers, and has widely presented both nationally and internationally. He received an award for highly qualified physicians from the government of Pakistan in 2014. He's currently the chair for Mental Health America Houston. Viewers, I am talking about none other than Dr. Asim Shah.
Thank you very much.
Dr. Asim, welcome to the show.
Thank you, Mavish, or thank you for a very, very kind and nice welcome. Thank you.
This is all truth. I mean, to be honest, I was wondering, मैं क्या अंदर add क्या निकालूं? There was so much about you. How do you feel about it?
I mean, obviously, I feel overwhelmed about it, but truly, on a day-to-day basis, I don't think about any of that.
Yeah.
I mean, it just is Allah ka shukar hai, or you know, it just happened and it just continues to happen. So, what can I say?
And you're a very humble person. That is an addition, and not to mention a gem of a person. The people who know him know that how kind he is, and you know what an amazing physician he is. Like psychiatrists, we know about that without a doubt. Dr. Asim, before I forget, there is so much to talk about in the show, and I was like, you know, kya puchna hai, kya nahi puchna. Again, there is so much to talk about psychiatry. The first thing that I wanted to say is that I want to actually thank you and congratulate you at the same time for coming up with this idea of starting this kind of show that focuses both on mental awareness and, you know, all this issue. This is so important for us. Thank you for doing that.
Fully agree. And you know, thank you for bringing that, because I've done numerous shows. You know, we've done another show in which we invited all the physicians and all. But मैं हमेशा से ये सोचता हूँ कि we had to do something regarding mental health.
Right.
There is a huge stigma about mental health, as you know.
I totally agree. I totally
and
agree.
not only in our community, in every community. So, I mean, when we thought about that, the purpose of this show was to reduce stigma, to bring people together, to acknowledge what's happening and let people know that there is help available if you accept, and there are a lot of things which we need to discuss with them, explore. So, I mean, yes, सारा मकसद था, और I'm glad we found people who were willing to help. I have to thank especially Ibn Sina Foundation. They were very willing to help on that. So, I mean, that's how it's all started.
Yeah, that's pretty amazing.
Actually, it's the first of its kind mental health show, I think perhaps in at least Pakistani history, I know.
Right, and I think you have done an amazing job. It's a tremendous job on your part to come up with this idea, because, you know, viewers, we do all kinds of shows. We are doing, we talk about everything, but it's so unfortunate that in South Asia, in Asia, in all over the world, we don't really want to talk about mental health. For some reason, Dr. Asim, we just try to just not talk about it. Why do you think that we don't want to talk about mental health, or we don't want to tell people that something is wrong with us? Why do you think it's happening?
There are numerous reasons for that. If you think stigma, like we said, I said before, stigma is the number one thing. But even the word mental, and I say it all the time, so it may be repetition for some people, even the word mental has stigma in it.
Right.
When you use the word mental, stigma comes. Why cannot we call it behavioral health? Why cannot we call it psychiatric health? So that's, it starts with stigma.
Right.
And having said that, somehow we feel, Pakistani, Indian, South Asians, we feel that we're not going to have this issue.
Right.
This is not going to happen.
Why
this
is
is only
that?
A disease for you know, people.
Well, God knows who, right? Nobody wants to talk
Exactly.
about it, because we
Exactly.
think we're just we just think that we cannot be sick, we cannot be mentally, we cannot have any mental issues.
And if we are sick, the second thing is we feel that if we're sick, our relatives, our friends, our family can cure it. So
Right. This is
वो आपको सब सही कर देंगे. That doesn't happen necessarily. So I think we don't want to believe it, and if we believe, we want to deny it. That somebody else is going to take care of it, not us. So
Right. Do you think that there is some kind of we are afraid or we are scared of telling it to people or our friends
Sure.
that I feel sad or
There's
I'm
a
depressed?
lot of shame involved with that, which is the stigma part. That
Yeah.
people feel that if I tell so and so that I have depression, it's a problem. Now, in the last decade or so, depression, anxiety are a little bit more acceptable diseases. Bipolar is still not. Schizophrenia is
yeah.
still not.
Borderline
others are
is still not.
Borderline is
Nobody
still
wants to
not.
be called
And
that.
borderline, I always say, is one of the most serious and severe mental illnesses or psychiatric illnesses. So we are accepting some, which is good,
Yeah.
depression, anxiety, but not or ADHD, but not everything. At least we are on the path.
At least we are on the path, and I am glad we are on that path. And we need to, I think, we need to bring more awareness to people, and we need to tell them that it is okay. It is okay if you have a problem. If it is okay if you're feeling sad. It's just a normal thing, you know.
You know,
It's just-
our slogan for Meadows Mental Health Foundation, which is the Mental Health Policy Institute, is okay to say. So we say when we go to schools, colleges, it's okay to say. If you have a problem, it's okay to talk about it. It's okay
Right.
to say. So that is important, that you need to discuss your feelings. It's okay to say.
Right, and most of the times we're just waiting that we think that nazla, khansi, bukhar, zukam, those are real illnesses.
क्योंकि
You
वो
think,
नजर आते हैं.
right, because वो आपके you don't feel good about it, but we don't.
Those are the physical.
Right. We don't think about कि our brain is so important. If we are not functionally, working well, like, mentally, हमारा अगर दिमाग सही तरह से काम नहीं करेगा, तो our performance would go down.
And actually, studies show that if you have a heart bypass, if you're depressed, you're not going to recover quick. Any
Right.
illness, stress, plans, anything, everything is related to mind. That's the reason the show's name is Mind
Correct.
and Body.
True.
So,
Yeah, I really think that you chose an excellent name for the show also, Mind and Body. It's just like true connection there for people to see. Another thing that I really wanted to ask was that, there are so many fields of medicine, and so many specialties, so many subspecialties, and now there are subspecialties also. Why did you choose psychiatry?
that's a question I've been asked many, many times. And, I think about it, and the simple answer is, when I graduated, I wanted to be a cardiologist or a pediatrician.
Okay.
I'm glad I'm not, but I wanted to.
Okay.
And I came to States and did my research with a psychiatrist, or मेरे खालू psychiatrist hai, and I worked with him, and that kind of inspired me. That rotation, working with him, I got to know psychiatry more, because Pakistan में psychiatry का concept is very
Right.
minimal,
I agree.
very, very minimal. तो उससे फिर मुझे अंदाजा हुआ कि यार, this is the field in which you have to use your brain, not
Right.
like
A lot.
not like other fields in which echo is done by somebody else, EKG is done by everything is written. Nothing is written. There's no test in psychiatry. You have to use your brain. So then I became interested and went into it, and have never regretted a single day.
Oh, really?
Yeah.
Wow, how amazing is that? Did you, I know it's like asking way, way back, but do you think that during your rotations, was there any special case or any special thing that really, really caught your attention, and then you would be like, oh, I want to do this because,
Honestly, I'm a Dow graduate, and Dow में कुछ rotations जो थी, वो either sort of elective थी या नहीं थी. So our psychiatry rotation was basically minimal or none. So
Okay.
I don't remember anything from psychiatry rotation because nothing happened.
Right.
I was not even. Those were the rotations which you could skip and take another. So I
Okay,
didn't
yeah.
even take it in my med
Okay.
school. It is all after the med school.
Wow. Wow. Okay. So nothing in particular, like you saw probably a depression patient or something, like during your rotation in the United States, was there something that really caught your attention during doing a rotation, or
Yeah.
or you would say just the whole thing?
No, numerous things. Like my first year of residency, I remember my first patient, and patient was assigned to me. She was a female, and after a few times, she started saying, "I want to marry this doctor."
Oh my gosh! Wow.
And
yeah,
I actually ran away.
you did.
Went to my director, program director, and
Were you married at that time?
I was married.
Okay, you better
Yeah.
wait then.
So I went to my program director. I said, I'm not going to see this patient because, she's saying this. And the response I got was, you are going to see this patient. You will deal with your countertransference. Certainly have another staff with you, a nurse with you, sure. But you are going to see this patient, you have to deal with your countertransference. And I think that was awakening call
Yeah.
or a turning point that psychiatry is important and you have to see people, whether there is a challenge or not, you have to face it. So I
Right.
think it helped a lot if I look at it in hindsight.
Right, that's good. So your first case actually like really made you strong and
Yes,
you know kind of
absolutely.
just
Not the first day, but after a week or so.
okay. Okay, all right, that sounds very good. Okay, so I wanted to talk about anorexia. And I know a lot of people would agree that our young females, they are really into it. First of all, please define what is anorexia,
Sure.
and then we'll talk about the other sisters and related
So,
problems.
I think what has happened is that in this day and age, everybody wants to look good.
Right.
And somehow the definition of looking good involves you being thin,
Right.
involves you being maybe tall, and that is an issue.
Viewers, let's take a short break here. I know this conversation is amazing. We will be right back. Stay tuned.
We have expanded our clinics from one small clinic to 7 community clinics across the greater Houston and Port Arthur areas.
My name is Dr. Spencer Wood, and our goal is to provide high quality, affordable care for the community.
इब्न सिना में प्राइमरी केयर डॉक्टर्स के अलावा बहुत सारे स्पेशलिस्ट भी अवेलेबल है, जैसे कि कार्डियोलॉजी, डर्मेटोलॉजी, साइकेट्री, पोडाइट्री, न्यूरोलॉजी, नेफ्रोलॉजी और दीगर स्पेशलिस्ट मौजूद है जो आपकी सेहत की टेक केयर कर सकते हैं.
We are providing services like preventive care, including exams and dental cleanings.
Counseling and psychotherapy. If medicine taken properly can give a good life.
इब्न सीना की सर्विसेज जो मेडिकल सर्विसेज से शुरू हुई थी वो एक्सपेंड हुई मेडिकल, डेंटल, डायग्नोस्टिक, स्पेशलिटी केयर एंड मेंटल हेल्थ सर्विसेज. हमने स्पेशली मेंटल हेल्थ सर्विसेज सिंस लास्ट 1 ईयर से एक्सपेंड की है.
Viewers, welcome back. I'm sorry we had to cut because of the break. Let's continue, Dr. Asam. You were talking about anorexia.
Sure. So जैसे पहले जिक्र हो रहा था कि एनोरेक्सिया वो बीमारी है जिसमें कि आजकल जैसे मैं कह रहा था कि ये होता है कि everybody wants to be thin, slim, to fit in the society. If you're a little bit overweight, people try to bully you. We had a program about bullying also a
Right.
few
I
weeks ago.
loved that.
So इसमें ये होता है एनोरेक्सिया में कि जैसे आपने कहा कि औरतों को ज़्यादा होता है लेकिन मर्दों को भी होता है, लड़कों को
Yeah,
भी होता है, मर्दों
I
को भी होता है,
agree.
but yes, females are more affected. And what happens is that they have a wrong perception of their body. So even if they are 90 pounds, which is nothing, if you are a 5'2" each person or so, they feel they are overweight. So when they look at the mirror, they feel that they are overweight, and they need people to tell them they are not. Still, it doesn't work. Because of that, they continue to not eat, and some of them go to the point that they haven't eaten in days, weeks, even months.
Wow.
Significantly, just water or something, and they have to be hydrated, admitted to the hospital. So
Right.
it is a serious, serious disease. Actually, if you think about it, the mortality is the highest in anorexia. Why?
Wow.
Because of lack of nourishment, people can die. It's a very, very serious disease, but undiagnosed mostly.
Undiagnosed mostly, and I think the main problem is कि जो हमारे हम अगर मीडिया में देखें तो जो models आ रही हैं, they are stick thin models. They are literally, and now the
You have to
FDA
show your bones and all.
Right.
You cannot eat.
unless you don't have bones or you don't have a bony structure or something, like it's just you're not considered pretty, which is absolutely wrong. I mean, you should be confident in the way you look.
Absolutely.
You
agree.
should be comfortable with your body, with your
Another thing people need to know is that when they diet a lot, the freshness goes away.
the freshness
So-
goes away, the glow on your face goes away. You have to keep that in your mind. For all the girls who are watching the show and want to look great, just be confident in your skin. You are beautiful. Let nobody tell you that you are not. So just on that note, I want to talk about bulimia now. Anorexia में तो लोग हैं कि
नहीं
they're
खा
not
रहे।
eating, खा ही नहीं रहे. Bulimia में क्या कर रहे हैं कि खा रहे हैं but they're puking, they're throwing up. वो निकाल देते हैं कि चलो टेस्ट तो फूड का हमने कर लिया ना. So what is that?
So bulimia में ये होता है कि जैसा आपने कहा they eat, but they love to eat. They eat. After they eat, they start feeling guilty.
Right.
उनको guilt होती है कि हमने क्यों खा लिया? We shouldn't eat. Then they put their hand and they throw up, and it is very common as opposed to uncommon. And these people, although they eat a lot in binges, meaning बड़े-बड़े meals लेंगे binges में, but they are still skinny because they throw up a lot also. Some of these people do 2-3 times a week, and it's terrible when they do that. और उसमें एक चीज़ ये होती है कि अगर माँ बाप चाहें तो अपने बच्चों के you can see the back, sometimes you see the marks or
Right.
something, and it's again when you throw like that you get electrolyte imbalance and it can be very serious. People have had seizures because of bulimia.
Wow, yeah. And also, when you are throwing up, आपका जब आप realize नहीं करते कि जब आप throw up कर रहे हैं तो वो जो acid आपका ऊपर आ रहा है वो आपकी सारी gut को भी involve कर रहा है. You know, you get GERD and you can get like so many, you know, erosive problems in your esophagus, which is your food pipe. So I think just we need to bring more awareness about it.
Absolutely. इसी से बात जो कर रही है उससे एक चीज़ और मिलती है, that is body dysmorphic
Right.
disorder. अब वो क्या है, उसमें ये होता है कि कई लोगों को फिक्सेशन होती है कि most commonly कि my nose is not right, or my eyelid is not right, or my lips are not right, and when they look into the mirror they feel that there's something wrong, and a lot of people go for surgeries for that. And
Right,
if
it's
they don't go for
unnecessary
surgery,
surgery.
exactly, and they
Right.
feel bad, so they spend a lot of money and they continue to feel that ये चीज़ फिक्स हो गई तो अब कोई और चीज़, तो
Right.
that's also another thing which is related to that.
And then we saw in our, we see in our medias, we have actresses who are going for this and that surgery, and then everybody is like वो भीड़ चाल का शिकार हो जाते हैं लोग के जी, you know, फलानी actress ने model ने या कोई media के बंदे ने did something, and so I need to do that too. No, you do not need to do that.
Yeah,
You know.
Botox, hair transplantation, all
Right.
those things.
We are going for breast augmentation, which is totally unnecessary. If you don't need it, you don't go for it. But like people are doing that, and then hip implants are there. We have Kardashians. People are looking for it. After that, people are like they did that. We're gonna do it too. So you know, it's just these kind of things. So we just need.
And a lot of these things, especially the Botoxes and all, you have to do
Right.
again and again and again.
You
it's
have
not
to-
a cure. You have to go for every few months and get it
Right.
done.
It's not a cure. Again, I'm glad you brought it up because
I think the key is you need to be happy within yourself.
right.
Whatever you are, if you are happy within yourself, why do you want to change yourself? For
Right.
example, I have white hair, so
So what? I mean, I think you look
it's
great
fine.
in it.
I'm not going to change this
Right.
hair color just because to look younger. It's again within you. If you feel
Right.
comfortable, everything is fine.
You need to be confident
Exactly.
in yourself, in your own skin. That's so true. There is something called binge eating disorder. So how is it different from the other two?
So very similar to what you do in bulimia, binge eating, meaning that they eat a lot at one point, and then they want to either throw up or feel guilty and not eat for many days. तो आपने एक दफ़ा बहुत खाया, and then either you're going to throw up and not eat, or you will not eat regardless. So all in सब चीज़ों में जो बात है, और binge eating actually is very common. more
You're
common
right.
than the other two.
Binge eating is very common.
होता ये है कि तीनों में, बुलिमिया में, binge eating में, एनोरेक्सिया में, मरीज दुबला ही होता है.
Okay.
क्यों? क्योंकि अगर खाया भी ज़्यादा तो उसको फिर लूज करना है या उसको नहीं
Right.
करना, तो नेट रिजल्ट दुबला ही होगा. लेकिन एनोरेक्सिया इज ऑब्वियसली द मोस्ट सिवियर फॉर्म व्हिच कैन रिजल्ट इन malnutrition also.
अच्छा, एनोरेक्सिया के बारे में पूछना चाहूँगी कि इज इट ओनली अ सर्टेन एज ग्रुप में है या आप आई एम श्योर यू सी अ लॉट ऑफ पेशेंट्स ऑफ एनोरेक्सिया नाउ, व्हाट्स द मोस्ट कॉमन एज ग्रुप? किस एज ग्रुप में आप ज़्यादा देखते हैं और किस में कम है?
Sure. Most of the psychiatric illnesses begin in early adolescence or teens. So does anorexia. But it doesn't mean that it cannot happen to somebody who's 40, 45. It can. Rarely, but it can. So होता ये कि if somebody starts having these problems when they were a teenager or early 20s, maybe they will get better and sometime it resurfaces. Very rarely it starts late, but it can. Bulk of it, again, teenagers, early 20s, that is the age when this happens.
Okay, so it can be, it's usually in the younger age group, but it can be in
Late
any.
also.
What,
Less common, but yes.
okay. What is the treatment? How do you treat them? Like, first of all, the thing is, when the patient comes to you, first of all, they're like, I am not anorexic, I'm okay, and how do you deal with them?
Right. Anorexia is not easy to treat. It's very difficult to treat because there is no set medicine. There are some medicine like fluoxetine, Prozac, which you can use for bulimia, anorexia, but they are not the pure cure. So, pehle ye ki you have to change the thinking, mentality of the patient.
Right.
Because whenever they look at the mirror, which they don't want to actually look at the mirror because they feel fat,
Right.
they feel bad. So you have to change that. You cannot change that with medicine. For that, you need CBT.
CBT.
And we'll talk about that in a second. So CBT is needed. Other than that, you try to treat the symptoms. Agar mareez uski wajah se depressed hai, which is very common, you
Right.
treat depression. If they have perceptual problems like they are feeling a little suspicious that people are looking at them because they are thin or so, you may add a little antipsychotic or something like that. So आप symptoms को treat करते हैं, लेकिन main cure मेरे साथ थोड़ी सी है. Main cure is CBT, in which you try to work on the positives of their life and try to reframe the negatives or negativity or these things or the feelings you have कि नहीं मैं मोटा हूँ या मोटी हूँ, and that is because of the mirror. So you try to emphasize you're not by factual figures. For example, your weight is 90 pounds, but other people of your age are 130 pounds. So
Right.
where does the facts match?
And the same for bulimia or
Same thing.
binge eating?
Same.
Okay, wow. So basically for what I've seen, like for most of the cases, psychiatric disorders, CBT is always there. So I think talking is very important. So now when we say talking is important, is talking with the doctor important, or how important is the family? What's the family's role in that?
Like you said, CBT is very important in most diseases. We talked about eating disorders, उसके अलावा anxiety makes important, depression makes important, phobias, panic, it's very important. Maybe psychosis, it has less role because you're not cognitively there or perceptually there or severe mania or acute mania. But talking to family, at least I feel, is extremely important. Family or caregiver.
Right.
When I say family, I mean if you're married, your spouse, if you are a child, your parents, or whoever is your caregiver. Why? Because every patient will come and tell us a different story. Family will tell you a different story.
Oh, really?
So patients
Wow.
can say, oh, I'm doing fine, I sleep good, I don't drink. Wife will come or husband will come, everything changes. So you have to have other side of the story also. Sure, you don't need to keep them in the room the whole time, but maybe give 10-20% of your session time to the family, to the caregiver to get their aspect, and then talk to the patient. And I do that a lot, every time or every other time, because I think that's the key. I see some people complain and say, oh, the psychiatrist doesn't talk to the family. Not good.
Oh, okay. Because like I worked in Pakistan in the capacity of a physician, I know the rules and regulations and the laws are totally different. In Pakistan, when you are in a hospital and you're working there, if somebody is diagnosed with something, आप जाके सबको बता देते हैं कि जी इस बंदे को ये मसला है. Before sometimes before the patient doesn't know what he has, and everybody knows it. So what is the privacy criteria in this? And then there is also a talk about the breach of privacy.
Sure.
So
यहाँ पे जो regulations है, that is governed by HIPAA. HIPAA is the privacy law which is all over the country. And basically what is HIPAA? Okay, you cannot disclose any information. You can talk to other providers
Right.
about continuity of care, but you cannot disclose anything. And another last thing before you
to go on
end,
break.
Yes. So another last thing is, and I know program is ending.
Just one on this note, I know you have to talk about HIPAA, and thank you for talking about it. Do you have just one line to say
Sure.
quickly?
So what I was saying about HIPAA is that, for example, if I see a lot of Desis, a lot of Pakistanis, a lot of Indians, if I see them outside, I don't even try to acknowledge. Why? Because I want them to acknowledge. If not, I won't, because we cannot detail anything about anybody. We shouldn't, just like in Pakistan.
Right.
It's very important to keep privacy of your patients in this country.
Thank you so much, viewers, for watching this show. We had a great time, and definitely so many questions and so many things are left unsaid. We will continue this. Please watch the next episode. We will be there for you guys. Stay tuned to watching this show. Have a great time and stay blessed.